personal support workers, commonly referred to as PSWs, are trained care professionals who provide a range of supports to a care recipient. In reality, many people may need and benefit from additional hours beyond what they are eligible for through home and community care support services. There are three options for accessing paid PSW services. The first and most affordable option is often through your local community support services agency. Similar to home and community care support services, nonprofit seniors agencies provide PSWs to assist a person with personal care tasks such as bathing, toileting, dressing, feeding, and medication reminders. Some can assist with housekeeping and meaningful activities. However, these services face a high demand, and they may not have any PSWs available. Wood Green covers the majority of East Toronto, and there are other smaller agencies in the area as well. Nonprofit agencies, like Wood Green, receive funding from the government and private donations to help subsidize the cost of care for their clients. The subsidy is built into the hourly rates provided, and as of January 2023, they typically charge anywhere from $18 to $28 an hour, depending on the agency. For people who are considered low income, typically on old age security or the Ontario Disability Support Program, you can ask for a financial assessment to see if you are eligible for further reduction in the hourly cost for PSW services. The second option is to enlist a private PSW agency. There are several agencies available that service the East Toronto area. In addition to bathing, toileting, dressing, feeding, and medication reminders, these agencies can assist with housekeeping, laundry, trips into the community, meaningful and recreational activities, and exercises. Private agencies charge higher fees than nonprofit agencies and therefore have more flexibility in what they can offer. As of January 2023, their rates are typically $30 to $45 an hour, depending on the agency, the service being provided, and the hours agreed upon. Usually, there is a 3-hour minimum for service. While this can quickly become a sizable cost, private agencies are typically able to accommodate more desirable service hours and have a faster turnaround time for service requests. The third option is for PSWs, or undesignated care providers, who can also be hired privately. This can be a more affordable option than using a for-profit PSW agency. You would negotiate the pay rate directly with the worker, and you would need to seek out, interview, and hire the person. And if they are sick or unable to work, you would also have to arrange alternate help for your care recipient. You can use a private brokering agency, browse seeking employment ads or postings on caregiver and nanny finding websites, or find someone through word of mouth by asking people you know for referrals. If you choose to hire a caregiver independently, then you would be the employer rather than an agency. You could arrange for the tasks to be completed to be flexible and based on what the person needs, and what the PSW or care provider is comfortable and capable of doing. They may also be willing to discuss live-in caregiving. You would need to negotiate the fees for this with them. It is generally recommended you ask the PSW, or the private brokering agency, if they can provide a valid Vulnerable Sector Search, or VSS. The Vulnerable Sector Search lets you know a person does not have a criminal background or any other infractions in their past. This helps to protect care recipients and their families. It's recommended that you ask the PSW you are hiring independently, or the agency you are using, to provide a current VSS. Beyond PSW care at home, your friends and family may also be able to help in looking after your care recipient. Perhaps there are situations where showering or toileting is not needed, and the person simply needs someone to sit and socialize with them. This could be an ideal situation where another family member or friend could come over and provide you with an opportunity to have time to yourself. This break in caregiving is often referred to as respite. In the next video, we will explore different services and programs available in your community, including other opportunities for respite. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.